Influenza is an acute viral infection of the respiratory tract, nose, mouth, throat, bronchial tubes and lungs. Transmission is by droplets, aerosol, or through direct contact with the infection. It's a highly infectious illness which spreads rapidly in communities. The usual incubation period is 1 to 3 days. Even people with mild or no symptoms can infect others. There were 6,534 deaths caused by influenza last season in those aged 65 or over. The flu vaccine is recommended for people at higher risk of getting seriously ill from flu. It is offered on the NHS every year in autumn or early winter. You can get the free NHS flu vaccine if you are aged 65 or over, including those who will be 65 by the 31st of March 2026, have certain long-term health conditions, are pregnant, live in a care home, are the main carer for an older or disabled person or receive a carer's allowance, live with someone who has a weakened immune system, and frontline and social care workers can also get a flu vaccine through their employer. Frontline health and social care workers should get the vaccine through their employer. If you cannot get a flu vaccine through your employer, you can get it at a pharmacy or GP surgery if you're employed by a registered residential care or nursing home, registered domiciliary care provider, a voluntary managed hospice provider, or through direct payments or personal health budgets. Influenza spreads rapidly, especially in closed communities such as nursing and residential homes. Vaccination of health and social care workers protects them and reduces the risk of them spreading flu to their patients, service users, colleagues and family members. 30 to 50% of influenza infections in healthcare staff can be asymptomatic. You can be infected with the virus and have no symptoms, but can still pass the virus to others, including your service users. A flu vaccine can reduce the risk of you getting ill by up to 60%. It's important to increase flu vaccine uptake in clinical risk groups because of the increased risk of death and serious illness if people in these groups catch flu. There are 749 adult social care settings in Lancashire and Blackburn, with Darwin providing accommodation for at-risk adults. Flu vaccination uptake needs to improve to reduce flu outbreaks in those adult social care settings. Only 13.5% of social care workers in the northwest of England have had the flu vaccine in the 2024-25 season. Last year, 1 in 4 people aged 65 or over missed out on the free NHS flu vaccine. In a typical Lancashire care home with 40 residents, that means that 10 people could be left unprotected, increasing the risk of serious illness and outbreaks. You should get your vaccine through your employer. They may give you the vaccine at your workplace through the Occupational Health Scheme. You may also be offered vaccination at your place of work when residents or patients are vaccinated. And you can also get your vaccine at your GP surgery or local pharmacy. I've already had flu this year. Do I need a vaccination? If you think you've already had flu, you will still need a vaccination as it will help you. Other viruses can give you flu-like symptoms, so even though you were unwell, you may not have had flu. Even if you did have flu, because there is more than one type of flu virus, you should still have the vaccine to get the best protection. I'm unwell, can I still have the vaccine? The vaccination can go ahead if you have a minor illness such as a cold, but may be delayed for illnesses that include a fever. Will I get flu from the vaccine? The injectable vaccines cannot cause clinical influenza. They do not contain an active virus. Those having the injection may get a sore arm at the site of injection, a low-grade fever and aching muscles for a day or two after the vaccination. Do the vaccines contain pork? No, the injectable vaccines available for flu immunisation do not contain porcine-derived products. The only flu vaccine that contains porcine gelatin is the nasal vaccine, recommended for children aged 2 to 18 years. You are able to discuss the options of vaccination with your vaccinator if your child is unable to consume pork. Do the vaccines contain egg products? Please let your vaccinator know if you have an egg allergy, An egg-free product should be made available. Can I have the flu vaccine at the same time as the COVID-19 booster? Yes, the COVID booster can be given at the same time as the flu vaccine if you're eligible. Can I have the vaccine if I'm pregnant? Yes, the injectable influenza vaccines can be safely and effectively administered during any trimester of pregnancy. Flu vaccines do not work well in babies under 6 months of age, and therefore vaccination is not routinely offered until after 6 months of age. It's important that pregnant people have the flu vaccine to protect themselves, and also because they will pass on some immunity to their baby that will protect them during the early months of their life. We thank you for watching, and we hope you all have a happy and healthy winter.